Hello everyone, this is Dr. Saru Siddiqui from the platform of UKMLA with DSS. And let's just continue our counseling structures and counseling sessions. Okay. The topic that we are going to discuss today is lifestyle counseling. Okay. So there would be a few cases in Plateau in which a person may be coming to you to seek advice on some lifestyle modification. Okay, maybe they might be disease oriented lifestyle modification. For example, somebody who has been diagnosed with MI and they got treated for MI, and now they're really worried about a future risk of heart attack, and they're really concerned about how they can modify their lifestyle to change it to a healthy lifestyle. So there would be people like that would be coming, or it would be a habit specific lifestyle modification. Like for example, someone may come to you and ask about assistance and ask about help in quitting their smoking habits. Okay, so you need to be ready for both of the cases. It can be either disease oriented or it can be just a habit oriented counseling about lifestyle modification. Okay, so let's just discuss one disease, and then you'll get an idea that how to do the lifestyle modification and what are the important things that you need to apply in the lifestyle modification. Okay, so this is the case in which you are an FI2 in medicine department. Mr. Elliot Jones is a 60-year-old man admitted 3 days ago with acute MI. He's being discharged home today and he's been prescribed with some medications. Okay, so there's a list of medications that have been mentioned. Okay, it is very important because you may have to explain these medications. Okay, so all the medication have been okay. So in this particular case, all the medication have already been explained to him. Okay, so you don't need to do that again. But he has got some doubts about his lifestyle changes. Okay, so that is what you need to counsel and that is what you need to discuss mainly. Okay, he's got some doubts about his lifestyle. All right, so now you know that there is a guy who has been diagnosed with MI, who has been treated with MI. He's got certain medication that all of them have been explained to him as well, but he just wants to inquire about a few lifestyle changes. Okay, so you'll begin your station by doing the introduction, by doing the repo building. Okay, and then jump onto the very first box, that is the eyes. Okay, so you have to ask about the fact that okay, I can see from my notes, Mr. Elliot, that you have some doubts about your lifestyle changes. Can you please tell me more about it? And then they'll start giving their concerns that doctor, I'm concerned about the fact that what lifestyle changes do I need to make. I'm really afraid about getting another MI, and I need to get back to work. So I need to understand that when can I go back to my work and when can I resume my day, my normal life, my daily life, like I used to do before. Okay, so they would just drop a few concerns to you. Again, since the patient would be dropping a concern about work, you need to follow up this thing with the question that is that can you please tell me what do you do for a living. Okay, because his concern is that can I go to work, when can I go to work. So you got to explore the concern that okay, can you please tell me what do you do for a living, where do you work, what kind of work do you do, what is the nature of your job. Okay, so you just explore the concern. Okay, and of course you need to explore this particular concern, that is the lifestyle changes. You would have to do data in a lot of detail, but yeah, that is for the later on. Okay, you can ask it in the box one as well, and you can leave it for box number two as well, like I have left it for box number two. Okay, so it completely depends on you, okay, where you want to explore it. Okay, then expectations, what are your main expectations as of today? Yeah, because I am expecting that you would be able to give me some advices, after which I would lower down my risk of developing another heart attack. Okay, so that is what the expectation would be. All right, now let's just move on to box number two, that is the six parameters that we need to keep in mind when we are discussing the counseling sessions. Okay, number one, explore the symptoms. Okay, so the patient had an MI. Okay, so you just need to explore the current situation. Okay, like how are you doing right now. Are you okay, are you having any chest pain at the moment, are you having any shortness of breath, any sweating, any nausea, any dizziness, Are you having any pain that is related to the arm or to the jaw? Okay, so you need to explore the situation. And how you're going to explore the situation? By basically exploring the symptoms of the heart attack, that make sure that the patient is not having any symptoms right now, and the patient is ready to be discharged, and the patient is completely all right. Okay, then comes exploring the let me just highlight the symptoms for you so that you remember it. Yeah, then comes exploring the risk factors. Okay, the lifestyle basically, and this is what the cornerstone of the data gathering of this particular session would be. Okay, exploring the risk factors. It is all about the risk factors. Okay, so what can be the possible risk factors of MI? What are the important lifestyle changes that you may suggest to a patient having MI? Number one, diet. Okay, can you please run me through your diet? How is your diet? What do you eat in the morning? What do you eat in the afternoon? What do you eat in your dinner? Do you take fast food? Do you eat out? Do you enjoy eating sweet food like desserts? How much coke do you drink? Okay, so you need to explore the diet in detail. Okay, don't just ask one question, that just can you just run me through your diet. No, the diet needs to be explored in detail. Why? Because this is what your main part of the data gathering is, and you cannot compromise on it. Okay, then you may want to ask about exercises, that okay, can you please tell me how much physically active you are? Do you walk? Do you run? Do you go to the gym? Do you do yoga? Do you exercise by any chance? Okay, so again, exploring the exercise in a bit detail. Okay, then you got to ask about smoking. By any chance, do you smoke? Okay, how many packs of cigarettes do you smoke in a day? Since how long have you been smoking? Okay, then same goes for alcohol. Okay, can you please tell me if you take any alcohol? Can you please tell me how frequently do you drink? Can you please tell me do you drink occasionally, or are you a chronic drinker? What kind of alcohol do you take? Okay, so this data part is like really important. Okay, and all of it needs to be explored in a lot of detail whenever it comes to the lifestyle modification questions. Okay, because this is a general lifestyle modification, right? Because the patient has an MI, you need to talk about the diet as well. You need to talk about exercise as well, and you need to talk about smoking as well, and alcohol as well. And that is the reason why I chose this particular station, because I could talk about all the different lifestyle aspects in one station. But in other type of station, they may just ask you to talk about smoking. They may just ask you to talk about alcohol. Okay, so you should know these set of questions that you need to ask whenever you are exploring a particular lifestyle habit. Okay, then this is like important, but other risk factors also may be important. Like for example, do you have any past medical illness like hypertension, diabetes, or any family history of any conditions? Okay, these are the risk factors of the disease, but not actually lifestyle modification pointers. Okay, so since you are discussing the risk, and since you are covering the risk factors associated with MI, you may just ask about these questions and these different parameters in this particular section as well. Okay, so yeah, then since it's a counseling session, you cannot just get away by just focusing on one aspect of the data gathering. You may just want to ask about the complications of MI, like for example, do you have any palpitations, any dizziness, any shortness of breath? And then psychosocial aspect, who is at home, nature of the work you do you drive? Okay, and these are the questions that you have asked before as well. And this is what the counseling structure is all about. There is no hard and fast rule. Okay, you could have explored these risk factors and these psychosocial aspect over here as well, in the concern aspect as well. Okay, but there is a very strong possibility that you may forget about a particular questions, and you may forget about a few parameters. So that is why this box number 2 and these 6 parameters are there for you, so that even if you forget about it, you know that okay, you eventually have to ask about the psychosocial aspect, and then you'll eventually end up asking this particular question if you have missed it in the session above. Okay, then meftosa part. Okay, meftosa part, you need to ask about that, are you compliant to your medications? Really important, because you would have to give this advice to the patient as well, that You need to be compliant to your medication, okay? And then family history of any heart condition. Again, you may see that, okay, there are a few things that are repeat, okay, but it's just mentioned so that you have an idea that it can be asked anywhere, okay, either in the wrist or maybe in the maftosa part, okay. And then the examination, that is the GP in the chest examination. Why? Because the patient has an MI, so you want to examine the chest, okay. So the take home point from box number 1 and box number 2 is basically the days up, okay. This lifestyle modification stations are mostly going to be days are focused, okay. So always keep this thing in mind. The questions of data that I just talked about and that I just shared with you, okay. How you're going to explore diet, how you're going to explore exercise, what are the questions you need to ask about when you are talking about smoking, what are the questions you need to ask about when you're talking about alcohol, okay. And in those stations in which you are typically dealing with smoking cessation or alcohol cessation, okay, then I'll tell you that how the symptoms would vary. You may ask about the symptoms of smoking, okay. What symptoms can be there in a patient who is smoking, okay. The patient of chronic smoker may have chronic cough, okay. You may ask about cough, you may ask about sputum, you may ask about fever, you may ask about shortness of breath, you may ask about chest pain in a patient who is here for smoking cessation counts, okay. Risk factors. In the risk factors, you're going to ask about the smoking habits, okay, like what are the smoking habits and all the questions of smoking that I just talked about, okay. And then you may ask about why did they start smoking in the first place. Was it peer pressure? Was it just to look cool? Or were they going through any stresses because of which they started smoking, okay. Then in the complication part, you may ask about any blood that might be coming in the cough, okay. Any severe shortness of breath, any lumps and bumps in the body, any weight loss, thinking about COPD, thinking about the chest cancer, okay, lung cancer. So you need to touch upon the complication in that aspect, and then psychosocial aspect would remain the same. Meftosa would remain the same, and the examination would also remain the same. Similarly, in the cases which are there for the alcohol sedation counseling, okay, you need to take the same approach. In the symptoms, just think about the fact that, okay, what symptoms can be there in a patient who is a chronic alcoholic. Think about liver gets typically affected, okay. So any pain in the abdomen, any right upper quadrant pain, any jaundice, any yellow discoloration of the urinary, changes in the color of your stool, any yellow discoloration of the skin, okay. And then somebody who is alcoholic, may develop hallucinations, okay, may develop central nervous system issues. Have you had any problem with your cognition? Have you ever felt dizzy? Are you feeling drowsy? And then you may ask about the drop in consciousness level. Are you seeing or hearing unusual things, okay. So like these are the symptoms that can be there. Then the risk factors, you would know that what are the questions you need to ask about alcohol. I just shared a couple of questions that are important when you are discussing alcohol. And then in the complication part, you may talk about any complications that may have occurred because of the mental health issues, because of the hallucinations. Has the patient harmed someone, or have they tried to harm themselves? Low mood, depressive episodes, okay. Think about the psychiatric aspect in chronic alcoholic patients, okay. Memory issues, very important. And then think about liver failure. That have you experienced that your stomach is increasing in size and it's being distended? To think about ascites, okay. Have you lost any weight? Have you had any lumps and bumps in the body? Think about liver cancer, okay. All of these complications. And then the psychosocial aspect, meftosa, and would remain the same. In examination, you would want to do the GP and the abdominal examination, okay. So I've just shared how these things would change from the case to case, from scenario to scenario, okay. But the basics would definitely be the same, okay. It's going to be there. All these six parameters would be there. Like I told you, I just discussed three cases with you right here, and I applied the same approach: the symptoms, the risk factors, the complications, psychosocial aspect, maftosa, and examination. I did not have any set of questions written in front of me. Okay, I just use my brain, and I just used that. Okay, if it's an alcoholic patient, what can be the possible symptoms? What can be the possible complications? All I remembered was that, okay, symptoms, risk factors, complications, psychosocial aspect, maftosa, examination. All I remembered was this, and then I automatically just uh, added the questions to each category, and my data gathering was complete for the smoking suggestion as well, for the alcohol suggestion as well. I did not have any notes open over here on neither on another screen. Okay, I just used this basic and applied it to make sure that I have the list of questions ready for me. Okay, so this is what I'm trying to teach you. Okay, this is what my goal is through the platform of UKMLA with DSS. For Plat 2 exam, I do not like the fact that a lot of candidates are like really scripted. They just wrote learn the questions and they just go out there and just say it out loud in a very scripted way. Okay, like the way I just used my brain, and like the way I just applied my knowledge into these categories to form basically the data gathering questions. Okay, that is what I want you to do for all the cases. Okay, for all the structures that we've been learning in this course. Okay, so yeah, we've talked a lot about data gathering. Okay, let's move on to the explanation. Okay, from the chat that we have had and from my examination finding, what I see is that you have a few risk factors that may lead to another heart attack. Say this if the patient is having some lifestyle issues. Okay, there are some non-modifiable ones which we cannot change. For example, your blood pressure, your diabetes, your male gender, your advancing age, your family history. Okay, however, there are a few things that are in our control and they can be modified, and they include a healthy diet, smoking and alcohol cessation, and a bit of physical activity. Okay, so right now I haven't gone into a very detailed advices in the explanation, but I've just summarized it for the patient, just given him a one sentence solution that, okay, what is happening, what can be done, what is other things that cannot be changed. Okay, and where the patient is currently standing. So what I'm trying to teach you, that always be complete in your consultation. Don't just give half-hearted knowledge. Okay, or don't just give incomplete knowledge. Okay, make sure that you are fully involved into the consultation. Make sure that you are able to explain things in the way I just explained it to you. I did not use very long sentences to explain. I did not just write the entire paragraph and just repeated it and just wrote learn it and just said it out loud. What I did was just summarize each and everything in a single sentence. Okay, so it was a summary, it was complete, it was telling the patient where they stand, it was telling the patient that what are the things that can be modified, what are the things that cannot be modified. Okay, so a lot of information, but in a very concise and in a very nice and a diplomatic way. That is what you need to learn in the counseling session. Okay, so now let's just go to the box number 4. The patient may have some concerns, like for example, the patient had that, doctor, when can I go back to work and resume my normal activities? Okay, so you should know this thing that, okay, they should rest for 4 to 6 weeks before resuming any manual work, but they can return to the work a bit earlier if they are comfortable. Okay, then when can I go back to work? Okay, so remember I asked you to ask one question, that do you drive? Why? Because if somebody is so worried about going to work, then there's a possibility that they may drive to work. Okay, so you need to avoid, you need to give advice about avoiding driving for at least 4 to 6 weeks. And if the patient is a bus driver, then they need to involve and inform DVLA. Okay, and we talked about in one of the lectures that what are the cases where you have to give driving advices, and what are the cases in which you have to involve DVLA. Okay, then the patient may just drop a concern to you, the doctor, when can I resume my sexual activities? They can be resumed whenever you are comfortable, although resting for 4 to 6 weeks after a heart attack is something that we recommend. Okay, so for the heart attack, it's always 4 to 6 week rest for most of the things. All right. uh, then they may just ask a question that, doctor, I have a business meeting, I have a flight, can I take the flight? And then you can say that, yeah, you can take the flight, but not right now, but in 2 weeks time. Okay, so not all of these concerns, but a few of these concerns would be there. Why? Because typically this is a lifestyle modification station. Okay, so not all of these concerns would be asked in a lifestyle modification station. Okay, all of these advices would be asked in typically a discharge counseling. Okay, but they may just ask a couple of questions, so that's why I just mentioned it for your knowledge. Okay, but the most important thing in this particular station, okay, the thing on which you would be marked on, okay, you would not be very heavily marked on this, you would not be very heavily marked on the concerns, you would be heavily marked on the advices that you give to the patient. Okay, lifestyle modification means advices. Okay, and basically the management of data. So, for example, this patient has all the issues, like the entire data is the problem. So you're going to give them advices about diet. Okay, so you need to say that, okay, we can provide you with a diet sheet. Okay, in which we can list down a few things that you can eat, and make sure that you take fruits, you take healthy diet, you take vegetables, and make sure that the harmful substance in the diet is reduced. Okay, we can increase uh, the amount of fish that you take. We can reduce salt, we can reduce oil consumption, and other than that, you can give them the advices of prioritizing home cooked food over fast food. Okay, so all of these advices needs to be there. These are the couple of advices that even you should know as a doctor, that they should take fish instead of beef and all. Okay, diet sheet is something that you should be aware of. Okay, talk about the diet sheet. Okay, talk about fruits. Okay, talk about vegetable. Reduce salt, reduce oil intake. Okay, all of these are the advices that you as a doctor should be able to give to a patient regarding the diet and regarding the lifestyle modification. Okay, and then you can just refer to a dietitian for personalized guidance. Okay, because eventually you would have to refer to your dietitian, you would have to involve the nutritionist on board as well. Okay, then alcohol. For the alcohol, you can limit and ask them to limit the alcohol under 14 units per week and reduce the intake gradually. Okay, and there is an alcohol suggestion clinic. Okay, you need to remember this thing, that there is an alcohol suggestion clinic and alcohol suggestion support available through uh, services like drink line. Okay, what they do is they also act as a one-stop solution. If somebody is a chronic alcoholic, you can just refer them to the alcohol suggestion clinic. They would be seen by GPs, they would be seen by counselors, they would be seen by psychosocial therapists, and they would provide them with a very extensive rehab program. Other than that, the drugs that are given to the patient who is trying to avoid alcohol, to avoid any withdrawals, avoid any physical symptoms. Okay, like disulfiram, like benzodiazepines. Okay, all of these drugs, acamprotase, all of these drugs are given to the patient who is undergoing alcohol cessation. Okay, so all of these medications would be offered to the patient at the alcohol cessation clinic. Okay, so for every alcoholic, for every patient who is undergoing alcohol addiction, the one-stop solution is alcohol suggestion clinic. Okay, other than that, in the advices, you can give them the advice to call drink line. Okay, which is basically a toll-free number that is available, that is a service at NHS, on which patients can call, and patients can talk about their addiction, and they can seek help to make sure that their recovery is better, and make sure that they do not experience that much withdrawal. Okay, so that is for the alcohol. And then you can give them certain advices, refer them to support groups as well, and counsel them to reduce the intake gradually and eventually cutting it down. Then for the smoking, you need to send them to a place called the smoking cessation clinic. Okay, again, just like the alcohol, a smoking cessation clinic is a one step solution, which offers medical support, which offers psychosocial support, rehab programs to help the patient put down smoking, and they offer nicotine patches, nicotine gums. Okay, and so to basically you know provide them all the assistance that they need to put down smoking. Okay, they may also provide you with electronic cigarettes, e-cigarettes, also known as the vape. That is one way of defeating smoking addiction. So they may provide you on advices like these, and apart from that, you should refer these patients to different support groups. Okay, and uh, take the NHS stop smoking services, and make sure that you talk about this particular service and counsel them, because this is something that they may need. As I mentioned, that they offer provide behavioral therapy. They also give medication like nicotine replacement, and they may provide you with support groups and with people who are also struggling with the same issues, so that together you can help fight this addiction. Okay, and just like the drink line, there is a smoke free national helpline available. Okay, so somebody is a smoker, you can just mention about this as well. Okay, all of these things are like really really important when it comes to lifestyle modification and like counseling about addiction. Okay, then comes the exercise thing. Okay, you need to recommend 20 to 30 minutes of exercise. Ask them to like walk, but do not start very aggressive and very hard exercises. Okay, and try to encourage them to, once they are completely recovered after 4 to 6 weeks, ask them to join a gym. Ask them to give them the advices that you can give on daily basis. Like for example, just ask them, the place where you work, uh, does it have a lift or does it have the staircase? They would say, doctor, yeah, they have both staircase and the lift as well. Then how about you try to develop your habit of using the staircase rather than using the lift. Okay, so that they can develop the habit of becoming physically active. So it's not just about what's written in the notes, and what's written and what's obvious. Try to understand what the patient is, and try to get into the shoes of the patient, and try to help him using those particular things. Okay, like for example, the lift and the stair example that I gave to you. Okay, so you need to have a holistic approach. That is what I'm trying to get to the point, and that is what I'm trying to teach. Okay, then you may want to refer someone who is not physically active to a local gym instructor. Okay, you may want to refer them to physical therapist who can help them, give them graded exercises, so that they can start becoming physically active. Okay, so you may have to make some referrals over there. Okay, then the referrals and admission, like I talk about, if it's a lifestyle modification case like this, in the cardiac rehab would be the right place to refer. Okay, then you can refer the patient to the smoking cessation clinics. Okay, you can refer the patient to uh, alcohol cessation uh, clinics. Okay, then you may want to refer the patient to a nutritionist. Okay, then you may want to refer the patient to a gym instructor. Okay, they may not be official like NHS referrals, but you may just want to mention about them, like a gym instructor. That is something which is not provided by the NHS. Okay, uh, then in the management part, you can just talk about these medication, but only if it states that they have not been explained to him. In this particular case, the medications have been explained to him. Okay, so you don't need to like repeat it all over again. And then safety netting may be important, because this patient, if she is coming to you for a lifestyle modification advice, then that means that he is already at a risk of developing something fatal. So just safety net on those conditions. If somebody is coming to you for lifestyle advices regarding smoking, safety net him on lung cancer, on COPD, on COPD pneumonia. And somebody if is coming to you for alcohol counseling, then safety net this particular patient on the possibilities of liver cancer, ascites, okay, liver failures, okay. So like what to safety net, and it really depends on case to case, okay. So yeah, that is what the lifestyle modification was. That is what the DESA counseling was, okay. So I've tried to cover a lot of things in a lot of detail, okay. And I hope that things are clear in your mind. But if there is any confusion, any query, please drop them down in the comment box below, or reach out to my social media. I would love to address all your concerns. And if you want a personalized mock with us, then scan the QR code for more details. That's it from my side today. I'll see you in the next lecture.